My typical week can vary depending on whether I'm doing a clinical placement or I'm on lectures. On a clinical placement week, I'll maybe go to ward round 2 or 3 times in the mornings, and I might go to some clinics as well, maybe in the afternoon. I might spend some time talking to some patients, taking histories and doing examinations. And then on a lecture week, it will be kind of like lectures 9 to 5, where I'll be learning the theory behind the medicine and maybe doing some other practicals with actors, so learning communication skills with actors who pretend to be patients. So it's really variable. So there are really 2 types of practical elements. One being the more scientific side, so the science practicals and maybe dissection some medical schools would do. That's a challenge in itself because you're learning different kind of dexterity skills, you're working with your hands. And then there are other practical sides like with the patients, so where you learn about clinical examinations and you're learning to maybe take blood and do other skills associated with medicine. And it's quite good because you get a lot of time to practice, and you get like a book and you go out into the hospital and you just try and get everything signed off. And people are really friendly, nurses, doctors, midwives, they all really help you to get what you need done. So I think my favorite experience that I've had is we were able to follow a pregnant woman through her pregnancy. We had several appointments with her where we went to her house and interviewed her. And I thought that was really valuable, taking kind of not only the medical aspect, but the patient's experience and hearing kind of about her as a patient and a case study. And I think that's really valuable in learning about people and their experience of healthcare. The reason I wanted to study medicine is because I see myself as a people person, and I really like that kind of human interaction. And I was also quite good at science, and I think medicine's the perfect subject to kind of mix those 2 things together and allows me to practice the academic side, but also the kind of human connection that I wanted as well. When choosing what subject I wanted to study at university, I was quite conflicted. There were lots of things that I was interested in, but when I really thought about it, medicine was the one thing that matched my interests and my strengths, so that's why I chose to study medicine. In preparing to apply for university, I wanted to make sure that medicine was the right thing for me, so I did some shadowing in a hospital, and that was quite useful because it got you to see what it was like to actually do the job in the hospital on the ground. And that's really invaluable when you're thinking about coming out of university and what you'll end up with. It's really good to see what job you'll be in. So once I graduate, I'll become a foundation doctor, and in that you start off doing general jobs and then you get to choose. I want to do personally psychiatry, but the good thing about doing foundation is that you can try a bit of everything before you make your choice. My top tips when applying to medicine would be, number 1, to make sure it's actually the job that you want. So maybe talk to some doctors, talk to nurses, go to a hospital and have a feel for the environment and see if it's somewhere you'd actually want to work. Maybe secondly, read around the subject, look at the news, just pursue things that interest you around it and see where that takes you.